What if your body has been secretly broadcasting your internal health status to the outside world, completely in plain sight? Think about your last routine checkup. Before a doctor listens to your heart or orders a single vial of blood, they almost always perform a rapid 5-second sequence. They flash a pen light into your eyes, ask you to stick out your tongue, and grab your hands to closely examine your fingernails. They aren't doing this out of habit or tradition. They are checking an intricate biological dashboard. The human body is highly interconnected, and minor physical anomalies in these three specific areas are often the very first indicators of hidden nutritional deficiencies, chronic organ strain, and systemic diseases long before you experience any noticeable pain or sickness. Introduction. Welcome back to our health channel. In clinical medicine, diagnostic testing is incredibly valuable, but an experienced physician's greatest tool is their power of observation. Your eyes, tongue, and nails act as a structural timeline and living canvas for your metabolic health. Because these areas feature rapidly multiplying cells, delicate microcapillaries, and direct exposures of nervous system tissue, they show internal physiological changes faster than almost anywhere else on your body. Today, we are breaking down the exact medical checklist doctors use behind the scenes to decode your body's subtle whispers. The story of David, an internal crisis in plain sight. To understand how profound these signs can be, consider the real-life medical case of David, a 42-year-old corporate accountant. David booked an appointment complaining of a slow, creeping sense of fatigue, frequent afternoon brain fog, and a general lack of mental focus. He chalked it up entirely to work stress, poor sleep, and burnout. However, the moment he sat down in the examination room, his doctor didn't see an overworked accountant. He saw glaring physiological alarm bells. When the doctor gently pulled down David's lower eyelids, the delicate tissue underneath was completely pale instead of a healthy, vibrant pink. When asked to show his tongue, it appeared unusually smooth, glossy, and beefy red, completely devoid of its normal textured bumps. Finally, looking at David's hands, the doctor noticed his fingernails were thin and dipping inward in the center, taking on a distinct spoon-like shape. Without needing to wait for urgent lab reports, the doctor immediately diagnosed David with severe iron deficiency anemia. David didn't need psychological burnout therapy. His body's oxygen delivery system was actively crashing, and his exterior anatomy had been shouting for help for months. Once his iron stores were clinically restored, his energy returned, his brain fog vanished, and his physical signs normalized. This is the power of understanding what lies beneath the surface. The windows to your internal organs, the eyes. Let's start with the eyes. When a doctor peers into your eyes, they are quite literally looking at the only place in the entire human body where central nervous system tissue and blood vessels are directly visible without making a surgical incision. The sclera, the whites of your eyes, the white structural part of your eye should always be clean, bright, and clear. If a doctor notices a distinct yellowish tint, a condition known as jaundice, it triggers an immediate investigation into your metabolic filtration system. This yellow discoloration is caused by a buildup of bilirubin, a waste byproduct created when old red blood cells are broken down. Normally, your liver filters bilirubin and excretes it safely. If your sclera turns yellow, it means your liver, gallbladder, or pancreas is heavily compromised, inflamed, or dealing with a structural blockage. The conjunctiva, the lower eyelid lining. By gently placing a thumb beneath your eye and pulling the lower lid downward, a physician exposes a dense, delicate network of microscopic capillaries. In a healthy individual with optimal blood volume, this tissue should be a deep, vibrant pink or bright red. If it looks pale pink or stark white, it is a definitive clinical marker of a drop in hemoglobin, the iron-rich protein responsible for carrying oxygen through your bloodstream. This quick check can alert a physician to internal bleeding, chronic malabsorption, or advanced anemia. The cornea ring, arcus senilis. If a doctor observes a prominent white, light gray, or hazy blue ring tracing around the outer edge of your cornea, their interpretation depends entirely on your age. In individuals over 60, this is an incredibly common, benign condition called arcus senilis, caused by routine fat deposits as the eye ages. However, if a doctor spots this exact same ring in an adult under the age of 45, it flashes an immediate warning flag for hypercholesterolemia. This indicates that your blood lipids are severely elevated, putting you at a significantly higher risk for early onset cardiovascular disease and strokes. The gastrointestinal mirror, the tongue. Next, the doctor will ask you to open your mouth and extend your tongue. In both ancient clinical paradigms and modern internal medicine, the tongue is considered a direct mirror of your gastrointestinal tract, hydration status, and nutritional absorption. A healthy, fully functional tongue should always be uniform pink, consistently moist, and blanketed in hundreds of tiny fuzzy bumps called papillae, which house your taste buds. The atrophic, smooth red tongue. When the tongue loses its signature velvety texture and becomes completely smooth, glossy, and deep crimson, it means your papillae have completely atrophied and died off. This is a classic systemic marker for severe vitamin B12, folate, or iron deficiencies. Because the cells making up your papillae require an immense amount of oxygen and micronutrients to constantly regenerate, a nutritional drought causes them to wither away first, leaving your tongue looking like polished glass. The heavy white paste. If a doctor opens your mouth and sees a thick, cottage cheese-like white coating covering your tongue that can be scraped off but leaves a raw red base underneath, they are looking at oral thrush. This is an acute, localized overgrowth of Candida yeast. While it can happen after a standard course of heavy antibiotics clears out your body's good bacteria, a persistent white coating in an otherwise healthy adult can be an early indicator of a severely compromised immune system or undiagnosed type 2 diabetes, as high sugar levels in your saliva feed the yeast overgrowth. Deep fissures and cracks. While minor grooves in the tongue can be completely harmless or genetic, the sudden development of deep, painful vertical and horizontal cracks can point to a state of chronic cellular dehydration. Furthermore, if the tongue appears chronically dry alongside these fissures, it can signal an underlying autoimmune condition like Sjogren's syndrome, where the body's immune system erroneously attacks its own moisture-producing glands. 3. The 6-month physiological timeline, the nails. Finally, the doctor will take your hands and examine your fingernails. Because it takes roughly 6 months for a human fingernail to grow completely from the root to the tip, your nails act as a permanent, slow-moving physiological hard drive, recording the major health events and stresses your body has endured over the past half year. #spooning koilonychia. Healthy nails possess a natural, gentle, outward curve. If your nails lose this shape and flatten out, or worse, bow deeply inward to the point where they can hold a literal drop of liquid like a spoon, you are displaying a condition called koilonychia. This structural malformation is almost exclusively tied to long-term, profound iron depletion, or a rare metabolic liver disorder known as hemochromatosis. Clubbing. When a doctor looks at your fingers from a profile view and notices that the tips of the fingers are bulging out and the nails are curving sharply downward, resembling the back of a metal spoon, it is called digital clubbing. This occurs because the tissue beneath the nail bed undergoes abnormal vascular proliferation. Clubbing is a massive red flag indicating chronic low blood oxygen levels, often caused by severe pulmonary diseases, lung cancer, or congenital heart defects. Bowes lines. If you look closely at your nails and see distinct deep horizontal ridges or grooves running left to right across every single nail plate, you are looking at Bowes lines. These lines mark a specific date in your past when your body experienced an immense life-altering metabolic shock, such as a severe case of COVID-19, a prolonged high fever, major surgery, or an intense round of chemotherapy. The shock forces the body to redirect all its cellular energy away from non-essential tasks like growing nails to keep your vital organs alive, temporarily pausing nail production and leaving a permanent scar in the tissue. The critical emergency sign, the dark vertical stripe. While many nail signs point to vitamin deficiencies or historical stress, there is one visual cue that doctors look for with absolute urgency. If they spot a single dark brown or pitch black vertical band running straight down your nail bed from the cuticle to the tip and you have no history of crushing your finger in a door, they will immediately order an emergency biopsy. This specific pigmentation can be an early indicator of subungual melanoma, an incredibly rare but highly aggressive form of skin cancer that hides directly beneath the nail plate. Actionable advice: how to perform a safe self-scan at home. Learning to observe these signs is a powerful way to become an active participant in your own health journey, but it is vital to approach this with logic rather than panic. Here is how you can perform a safe baseline check on yourself at home. Always use natural morning light. Artificial, yellow, or fluorescent indoor bulbs can severely distort the true color of your eyes, tongue, and nail beds. Stand near a bright window in natural sunlight for an accurate view. Apply the 2-week consistency rule. A temporary red spot on your sclera from coughing, a minor burn on your tongue from hot coffee, or a small white spot on your nail from an accidental bump are completely normal localized traumas. You should only note down changes that are systemic and persist continuously for more than 2 to 3 weeks. Log photos, don't self-diagnose. If you notice a persistent pale eyelid lining, a loss of tongue texture, or unexpected horizontal ridges on your nails, do not open a search engine to self-diagnose your symptoms. Take a clear, well-lit photo, keep a brief log of when you first noticed it, and present this visual timeline directly to your primary care physician at your next visit. Conclusion and CTA. Your body is an incredibly intelligent, beautifully designed system that is constantly trying to communicate its internal state to you through these small external whispers. By learning to recognize and respect what your eyes, your tongue, and your nails are saying, you can catch health issues early and take proactive steps to support your vitality. If you found this clinical breakdown insightful and want to unlock more practical secrets to optimizing your body and understanding your health, make sure to hit that subscribe button, tap the notification bell, and leave a comment down below. Have you ever noticed any of these unique signs on your own body? Let's start a conversation, look after yourselves, and we will see you in our very next video.